What a good way to start your morning. Welcome to the Good Morning Africa show on Housing TV Africa. Today, it's going to be a very insightful and informative one. Talking about October, which as we all know is Breast Cancer Awareness Month. We need to educate the viewer out there. We need to sensitize you. We need to let you know that it is very, very important to pay attention to your breast. You need to know if, you're having changes in your body. There are little and simple symptoms you need to look out for. I won't be having this conversation alone. We'll have a guest with us in the studio who is a professional. We'll be talking on this particular issue. But before we do that, I can make it is on standby. We'll be back shortly.
Hello and good morning. You're welcome to the I Can Make It segment. Now, I just want to walk you through a story that really touches my heart. A man named Golden once said, "Women are foolish to think that they are powerless compared to men because they actually are more superior than men." And he went ahead to say that give a woman groceries and she'll make you a meal. Give her a home, she'll make you a beautiful home. Give her your heart, she'll give you smiles. But he said, if you give her crap, she will give you ... Because women having the power to multiply. Another story comes to mind about a man named Joseph Stalin. It is recorded that he had about 7 million kills to his name. He was a USSR leader back in the day. He used power to the point whereby he put dread, fear, pain, unnecessary deaths in the hearts of men. You may be wondering why these two illustrations. I will juxtapose now. There is power that can empower positively, but there's also power that can empower negatively. It is in our hands, it is in our minds to choose the right way. Do we want power that has a positive ripple effect that will leave a beautiful legacy behind long after we're gone? Or do we want power that could destroy? It could also self-destruct. And what legacy do you leave behind long after you're gone? I'm here to inspire you because making the choice is in your hands. What are you going to do today? What do you fill your mind with when you're alone? What do you fill your time with to make you improve yourself? What do you surround yourself with? What caliber of people do you surround yourself with? These all matter. These gear towards building you to become who you'll be tomorrow. Until next time, keep winning.
Visit Housing TV Africa on YouTube and click on the subscribe button. Subscribe to Housing TV Africa to stay updated on latest happenings in Nigeria's housing sector. Follow our social media pages, like and share our posts. On Facebook, Housing TV Africa. On Twitter, Housing TV Africa. Instagram, Housing TV Africa. Join the conversation and keep up with latest housing updates.
you're just joining us, this is the Good Morning Africa show on Housing TV Africa. Good to see you have not missed anything because the show is just starting. Now, it is Breast Cancer Awareness Month, a month to educate and create awareness. Breast cancer is the most frequently diagnosed cancer in women worldwide, with more than 2.3 million new cases in 2020. Its incidence and death rates have created over the last 3 decades due to the change in risk factor profiles, better cancer registration, and cancer detection. How well are you informed about breast cancer? We have a professional with us today on the show to speak to us about how much we need to know about breast cancer. Thank you so much, Dr. Prasha Zacharia, for joining us on the Good Morning Africa show.
Thank you. Thank you, too, for having me.
You're welcome. It's the month of October. And as we know, beginning from the 1st of October till 31st of October is Breast Cancer Awareness Month. We need to sensitize people. There are people that are living presently with breast cancer. They don't even know that, hey, I think I'm suffering from breast cancer. I need to get help. It's very important that people know, the causes, people know how to, seek for medical attention and what to do. So before we go into all of that, what is breast cancer?
Okay, breast cancer is an abnormal excessive growth of the breast tissue, which can lead to some gross changes in the breast, and it can be debilitating to the point where other parts of the body is affected. Now, breast cancer is found in men and in women. However, it is more common amongst women. The incidence amongst Caucasians is more than that of Africa. Okay. But the difference is in Africa, we have an aggressive strain of breast cancer.
Please talk to us about that.
Okay, so you would see things like breast cancer, breast lump. I'm sure you're aware that it's not all breast diseases that are cancerous. Okay. We have breast lump, which is benign. When I say benign, I mean non-cancerous. Okay. When I say malignant, I mean cancerous. Okay. So it has been found through many studies done in Africa and in America that some of these benign lesions are commoner in African women. The major cause has not been found. However, we have risk factor for uterine fibroid, breast lump, and then breast cancer. All of these things are due to our race is one major risk factor. The things we are exposed to is one major risk factor. And the thing about it, like I said earlier, is that the exact reason why we are prone to it has not been found. Do you understand what I'm trying to say?
No, that's really scary.
Yes.
That's really, really scary because I know that usually when people have contact ailments, there are specific information that they get as to why they were being exposed in the first place. But not even knowing this is really scary.
Yes. Now, that will take me to risk factors.
Okay.
The risk factors are divided into modifiable and non-modifiable. When I say modifiable, I mean risk factors you can do something about, and then risk factors you can do nothing about. You understand? So let me start with non-modifiable risk factors. One is age. It is commoner in women 50 and above.
Wow.
Yes, though it can happen below 50 years of age. Okay. But it's commoner amongst women 50 and above. Okay. Now, sex. I said earlier that it happens in both men and women, but it's commoner amongst women. So if you are a woman, you can't change your gender, so you are more prone to having breast cancer, right? Then we have race. Like I said, it's commoner amongst white women, however, more aggressive in us. So these are things you cannot modify because that is just how your genetic makeup is. Now, we have family history. Family history, especially first-degree relatives. When I say first-degree relatives, I mean nuclear family, like mother, sister, when it's cousin, the likelihood is reduced to about 35%. Yes, but when it is a first-degree relative, 50%. Yes, of risk. I see you're already becoming affected by this information.
I am, honestly, I am, because you know why? Breast cancer is something that, when people hear about breast cancer, they panic.
Yeah, of course.
I don't blame them because,
Yes,
like you rightly said, it's one ailment that people don't really get concrete information as to the causes, you know.
You're right.
So it's scary.
Yeah.
And then hearing this from you that, oh, you can, you know, actually the risk factor, like you said, there's the hereditary thing,
yes.
and it comes from the nuclear family.
Yes.
You know, it's very, very scary.
Yes.
But it's very important that people
we
get
know
this information.
Yes, very important. So there are also some genetic factors. That is what is that's what makes people predisposed to it. You know, genetic makeup is not what you can see with the physical eye. So there are some genes which I won't bug you with, but we have some of them called BRCA1, BRCA2, tumor necrosis factor, TPN, and PTEN. Some of those genes, when some people have it, they are more prone to having breast cancer.
So how do people know these genetics in them? Is there a test they need to run? Is there something they need to do? Please talk to us about it.
So the thing about it is those things exist, those tests exist, however, not commonly found in our place here.
In Nigeria here?
Exactly.
Wow.
So, but then if it's abroad, the genetic testing is almost a normal thing. But here, before you even see molecular laboratories, it's rare to find. You understand? So most times as clinicians, we don't bug people with genetic testing. Okay. There are other things. So I'll talk about the, another non-modifiable risk factor is a previous history. Okay. If one has had a history of breast cancer before, there's an increased risk to have it again. You understand? Yes, there's an increased risk to have it again. Now, we have the modifiable risk factors. That's where people can do something about it. One, diet. Yes. High-fat diets. You know, these days, there are so many things coming on. Fatty food, they are now like the things that are in vogue. You understand? Get this meat, that meat. Some of these things that have high fat content puts women at a high risk of having breast cancer. Ooh. Obesity is a risk factor that is modifiable because, of course, you can take care of your weight, right? Yes. So we have OCPs, that's oral contraceptive pills. Okay. Those pills predispose women to having breast cancer. Why? Now, the thing about it is breast cancer is it is triggered by some hormones in the body, which are supposed to be normal in us. Estrogen and progesterone. Now, high levels of estrogen and progesterone increases the likelihood of having breast cancer. Funny thing is, these hormones are the ones that are implicated in producing breast in the first place. Ooh. So now, number one, another thing, sorry, I forgot to mention, amongst the non-modifiable risk factors is early menarche. Menarche is the age at which is the first menstrual period, the first menstruation of a lady. So ladies or girls that go through start menstruation very early, at early ages, 8, 9, they are more prone to having breast cancer because of their duration of exposure to the hormone called estrogen and progesterone. Yes. Then late menopause. Women that don't get menopause around their 45, 50, some people till like 60, they are still seeing their period. So they are more exposed to those hormones. So they are also more at a risk of breast cancer.
Yeah, so the female body is really an interesting one, you know, because, you know, the first thing they say is, oh, if you don't start your period in a particular age, you have a problem. Yeah. If you start, you know, so it's a very interesting body, honestly. But what do? We need to learn these things to be able to take care of ourselves properly. Exactly. So now let's come to type of breast cancers, which, you know, you earlier mentioned some, and then you made mention of not every lump in the breast is attributed to breast cancer. But how can people detect symptoms of breast cancer?
Okay, so first of all, the lump that comes up, you know, before, you know, the beautiful thing about medicine is that we evolve in knowledge. Oh, okay. So before we used to say painful lesions are cancerous, while non-painful are not cancerous. But the truth of the matter is that we have seen now that this pain usually comes when it's already getting to the late stage. Now, before we used to differentiate it that if you have a lump that is painless, is most likely benign and not malignant. But when it is painful, it is malignant. You understand? So, but then we've seen nowadays that even people that have benign breast lesions have some pain. And then people that have cancerous, the pain also still comes. So we don't use that to differentiate anymore. So the best thing is, if you notice any breast lump, move to the hospital. If you notice any skin change, darkening, extra darkening of your breasts, abnormally, you've never noticed it before, move to the hospital. If you notice a dimpling of the skin, like, you know, there's something we say, pseudo-orange sign in breast cancer. It's like the back of an orange, where your skin is, there's dimples. You know how orange back is. So when you find out that your breast is already showing such signs, there's no need for you to confirm if it's cancer or not in your house. You move to the hospital. Early detection is very important in breast cancer.
Okay, so because it's an educative section on the Good Morning Africa show, I'm going to be asking you some questions.
Okay.
Questions that, you know, a lot of people will be like, no, I don't think you should ask this, but it's very important here because we're talking about health and we need to educate people.
Yes.
So you spoke about, you gave an example using the orange.
Yeah.
Now, in a female breast, there's a nipple area and then, you know, there's the body.
Yes.
So where
Where
exactly is it around the nipple area or the body of the breast that women need to check on a daily to see if, you know, that particular dot or I don't know what you call it in the medical term. Yes.
Now the truth of the matter is that all of them, that sign that I mentioned is just one of it. But the pseudo-orange sign is on both the breast, the body like you mentioned, and the areola, the dark parts. Now the nipple, what you can notice about the nipple that is specific to the nipple is discharge.
At what stage do one start experiencing discharge? And is it every yes, and or on the breast, or is it every discharge? Every breast cancer comes with discharge, or, you know, people can still have some little infection here and there that could, you know, give them discharge and not scare them away that, oh, are you sure I don't have breast cancer already?
Now, that's a very good question. So, first of all, when a woman has a discharge, there are sometimes that during ovulatory changes, breasts are fuller, tends to discharge some milk-like substance.
Even when that woman is not pregnant?
Even when that woman is not pregnant.
Okay.
But that is an indication for something else.
Okay.
We call it high prolactin levels.
Okay.
Prolactin is the hormone that is involved in production of breast milk. You understand? So ideally, when you notice that milk, go to the hospital and be sure that it does not have to do with cancer. You can't sit at home with your body and see something and just assume or be afraid and just stay there. That's the essence of this education we are doing. When you notice it, you should go to the hospital and find out what it is. Because when a woman comes to my clinic and tells me she's having this milky discharge in excess, I would ask her to do a prolactin level first. After examining her breast, of course, if I don't find any lump, I'll ask her to do prolactin levels. If it is high, then I'll know what to give her. And if it is not, I'll ask her to do a breast scan. You understand? So that we can find out why it is happening. But you can't sit at home and assume, could it be this? Could it be that? No, that's wrong.
That's like giving yourself a self-medication, which at the end of the day, it's not good for you.
So
are cancer cells present anywhere else in the body, apart from the breast?
Oh, of course. First of all, breast cancer is abnormal proliferation of the breast cells, right? But breast cancer can metastasize. That's what we call metastasis of cancer lesions. You understand? So it can move from the breast to the lungs. It can even move to the brain. You understand? So that is it. It is not just, it is supposed to be a breast cancer, but in complicated stages, it can metastasize to other parts of the body. Very common place it metastasizes to is the lungs, the chest. So women come with difficulty breathing, cough. In fact, that is already a bad prognosis. That's a feature of bad prognosis of breast cancer.
So when someone is infected with breast cancer, at what stage will he or she, you know, start seeing some very funny changes? Or is it an immediate thing, or, you know, it has to take a week? Okay.
Sometimes some people have lump that they ignore for like 2 years, 3 years, and other symptoms will not start. So it's not usually immediate. The only type of cancers that you see them immediate are very aggressive cancers. There are some cancers that you see a lump today, and in the next few months, it's already big. The breast is already very big. Like some of them have this rapid growth, while some are slow growing. So the way we find out which kind of cancer is this, I was talking to a colleague of mine whose sister came down with breast cancer, and we were looking through the histochemistry results and histology results, and we saw that hers was a very aggressive one, rapidly progressing, you know, breast cancer, even after removal of the breast, still having symptoms, having some other masses beneath the breast, you know. So that's why I said, if you notice anything, it's not the time to be afraid. Yes, the thing is, the fear doesn't do anything to you. It doesn't do anything for you. So best thing is just to go to the hospital, a good hospital, find out, what is this, doctor? I'm worried. Because that my colleague that I'm telling you about, that the sister, she didn't actually stay at home. She went to a doctor. She went to someone and told him, you know, that I'm having this. Said, I beg you, you're too afraid. Gave her antibiotics, and that's how this woman's cancer cells continue to rapidly increase.
Dr. Precious, hold your thoughts, okay? I have a lot to find out from you today, because this topic, like I earlier stated while I was introducing the show, it's a very important topic. Women need to be educated. Women need to know that, hey, when you notice anything coming, you know, on your breast, even if you don't notice, go and do, just go, just go and check. It's very, very important. So we're going to take a short break. We have a video on standby. This video is, you know, just little steps on how to teach you, or teach every woman out there, when you're in your home, or you just had your bath, on how to examine your breast is very, very important. After this video, we'll come back and the conversation continues with Dr. Precious Zacharia. We'll be back shortly.
Breast cancer is the most common cancer affecting women in Singapore. It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breast, underarm and collarbone areas more accurately, do so by lying down, because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
Welcome back. If you're just joining us, this is the Good Morning Africa show right here on Housing TV Africa. Still discussing how much do you know about breast cancer with Dr. Precious Zacharia. Now, this brings me to my next question. How long can one have breast cancer without knowing?
Okay, so that question is relative. Like I said earlier, there are different people, different body makeup, different, even inside the breast cancer, we have different types, you understand? So sometimes it can range between months to years. It can range between 3 months to 5 months, yes, and even to 2 years.
And then you just be living your life on a normal and not even know you have breast cancer.
Yes, yes. Some may notice a lump and just think it's just minor pain and just leave it that way. They won't know if it's cancerous or not. But yes, you can have it for that long and not know how bad it is. You have patients come and say, when did you notice this thing? They'll tell you last year, 1 year ago. So it differs for several people.
So what happens? What happens to breast cancer if not treated?
Oh, okay. So what happens is that the cancer cells continues to increase. So the size of the breast continues to increase. Then at some point, the lesion will stick to the muscle behind the breast. We call it pectoralis major muscle. It will stay here. So you see that particular breast will be very hard. Very hard. It will stick there. And then the nipple, like I said, start discharging. It will look like a boil. You understand? Some people, I don't know if I should use the word, okay, let me use the word ignorantly burst the boil, take it to traditional people to just burst the boil, you know, and then progressively this cancer, the breast starts to fungate. When I say fungate, I mean it look like it is eaten up. You understand? You see pus, very smelling. Trust me, you can't even stay in a room where such a person is. Do you understand? So you see the breast tissue looking like a very chronic wound. You understand? With pus, whitish exudates, sometimes blood, then wound. The nipple will not even be found again. Sometimes the nipple automatically amputates itself.
Wow. Because
of the progressiveness of the cancer. So that breast is usually hard, and that's how it
Let us look at pregnancy and breast cancer.
Okay.
What happens if a mother is pregnant or let me just throw this before I, want to try to dig you too deep into it.
Okay.
Can a pregnant woman contact cancer?
Yes.
Oh, yes. Without her knowing?
Well, the thing about the pregnancy comes with breast changes. So sometimes, exactly. So sometimes they assume it's just the breast changes, But I have had a patient before. She came, she was pregnant. In fact, I met her when she was just 3 months pregnant. And then I was in O&G department at the time, and next time I was in surgery department when she was 8 months pregnant. She came and she's having this lesion on just one breast. You understand? It was really big and all of that. And well, we couldn't do anything for her because she was still pregnant. So we asked her to go. When she's done delivering her baby, she'll come back and then we'll take it from there.
Okay, so in cases whereby breastfeeding mothers,
Yes.
you know, have been exposed to breast cancer, and then the child sucks from that breast, is there any medical I don't even know how to put it, because right now I'm really scared. Honestly, I'm really scared. But for a breast feeding mother, yes, who has cancer and does not know, right, and is breastfeeding the child, does it have any medical effect on the child?
It depends on the stage at which the cancer is. For instance, if it's in lump stage, she might not notice anything. So the baby is not really at risk from the milk. Because the truth of the matter is that this cancer is the cells that are involved in the production of the milk that are proliferating abnormally. You understand? So for the baby, at that point, will not have any effect. But trust me, if the cancer has gone beyond, she won't be able to breastfeed. The pain will be too much. The way the breast will be, she will even be afraid to give the baby. But then if it's at lump stage, it doesn't have any direct effect from the milk to the baby.
So what are your thoughts on medical treatment and traditional treatment when it comes to breast cancer? Because I hear some few people saying that, oh, don't do medical. You know, they just waste your time. You go, they give you all of these, they take your money. The treatment is very expensive, but there are actually traditional ways that these can be healed. What as a practitioner and a Nigerian, because we as Nigerians, we still have traditional beliefs here and there. We have maybe one grand auntie or grandmother calling us, don't bother, don't go to the hospital. There's this leaf in the village that will just plug and then we'll squeeze it on the breast and you're good to go. So what are your thoughts on that?
Okay. Let me first talk about medical therapy in cancer. So we have several things we do, but one very important mainstay is surgery. You would have heard of it, mastectomy. So sometimes, you know, I talked about the fact that the cancer sticks to the muscle. So sometimes we do a debulking chemotherapy so that the cancer cell will release from the muscle and the skin so that we can easily remove it during surgery. Now, sometimes even with all of this, especially if it's aggressive or it took time before the woman came to the hospital, even with all of this, she still has some kind of little complaints, or the cancer starts in the second breast, you know, all of those things. So the truth of the matter is those traditional things have not been proven scientifically to be effective. And by experience, I have seen a good number of patients that come. That period that they've been at home, that they notice the lump, they've been working with those traditionalists, and then they come worse than somebody that came when it was early. So I don't believe in anything traditional, whatever, because what exactly do these traditional, those leaves, what are the agents that they have that is helping to shrink the cancer cells?
But then I don't want to argue with you on that, yes, but because we are Nigerians and we are Africans, you know, over the years, we have seen these traditional leaves, these herbs, you know, work wonders. Truth be told, forget the fact that we have, you know, the English medicine, like our elders will always say the English medicine and all, yes. But then for the medical aspect, when it comes to breast cancer, is it really 100% curable?
No, it's not 100% curable, but depending on presentation, you understand, depending on how early. I know breast cancer survivors. Yes, when you come early enough, because you know, you see this lump, like I said, it's common in Africa. So many young ladies, in fact, teenagers even have those breast lumps. So what we do when we remove it, we test it in the lab and see, is it benign or is it malignant? If we find out it's malignant, we start doing something so it doesn't progress. So that's how they are saved. When I was secondary school, I had a copper teacher that had such a thing, early diagnosis, and that was how she was saved from it.
Wow.
Yes. So now the reason most times it doesn't work for people are those that come very late. And most African women come very late. In fact, that's what the statistics say. That's why the mortality is more amongst Africans. It's because of this traditional thing you people are saying. The truth is, these things work. In fact, some chemotherapy medications are gotten from some plants. Do you get? But people went to school for these things. There are doses that you need.
True.
But traditionally, they just boil a whole pot and say you should drink it. What if it affects something else, or it is not? What if it isn't even enough? So people have gone to school. That's why we have pharmacists, pharmacologists. They've gone to school for this. They've done research on this, and they've come up with drugs and injections that work for this. So I can't have a family. Okay, let me talk like I have a family member. I can't have a family member with breast cancer and say we should do traditional. So I won't advise any other person. If I can't tell my family member to do that, then I won't advise any other person to do that. Go to the hospital. Let them do what they should do for you.
Indeed. So now let's look at the women in the rural areas, right?
Yeah.
It's enough that we're in the city, you know, people are exposed, people have read a lot about breast cancer, people have seen it in movies, you know, people have family members that have survived. Now let's come to the rural area, which I always love to come back to the grassroots. What happens to women in the grassroots? How can they be sensitized about breast cancer?
So, you know, what we are doing right now is very good, very important, because people will watch the TV and then get to know. But I think that that is why in public health we have primary health care centers. There are levels of prevention. There's the primordial level, primary level, secondary, and then tertiary, sometimes even quaternary. But then for the primordial, what we are trying to tell people is, how do we prevent the risk factors? You know, I told you about some that are modifiable.
Yes.
So we are supposed to actually go out. That's the thing. That you know, this question you have brought up is bringing so much emotions, because I have been saying I meet a lot of ignorant people in the clinic, and it's painful because they don't even know. So what I think we should do is, first of all, the government's part, let us invest so much in primary health care. Let us sensitize people. We cannot just speak English. We have to go and sensitize. Do screening tests for them. Screening tests might be as little as self-breast examination. Teach them how to even examine their breasts. Look to the mirror, check. Just teach them. And then talk to them about signs. These people, they also love their lives. So just tell them about the signs. When they notice this, let them come to the hospital. So we need to go out there. And then it's possible we can even have billboards, you know, around there, showing just small signboards or posters showing some risk factors. We've done some of those things. I've been involved in a lot of breast cancer outreaches where we just print posters about the signs, picture of the sign, put it there. You don't have to speak English. Put the sign. If you notice this, just come to the hospital. You understand? So that is one way we can reach those people in the rural areas. Then that way they can be prevented, because secondary prevention is where we diagnose early and treat promptly. So how will they get to secondary prevention if they don't even know what to do at primary level? So we need to go out there and really teach. And then, do you know, the funny thing is, even now, like you said, city anyway, some of these laboratories in Abuja, they are running discounts on mammography and breast scan. Okay, some of them 5,000, something that is in 20,000 and all of that. They've reduced the price for some people.
So people can just take advantage of that and go run tests.
Yes, advantage. But the painful thing is, the people in the rurals can't.
How do they get
How do they get
I'm more particular about them.
Yes, how do they get it? So it is a joint. It has to be a joint effort. The health sector, if we put them into consideration, it's not going to be a big deal to move those machines to some of these villages, you know, or even go to the villages and find out, okay, who are interested. After informing them about the benefits, who are interested, okay, let's go. Bring them to town, do it, or move the machines to them. Just check. You'll be surprised at the number of lives you will save that way.
Wow, it's been a very informative and educative discussion with Dr. Precious Zacharia on how much do you know about breast cancer. She has been able to speak to us about what we really need to know, how people can be able to detect if there's any breast cancer on your body. You just quickly rush down to the hospital, do your examination, speak to a specialist. It's very, very important. Don't go the local way. I don't know if I'm saying that,
Yes,
but some
please.
people will tell me, come on, you don't even know what you're saying. There's still some local medicine that work wonders. Thank you so much, Dr. Precious Zacharia, for coming. But before I let you go, please kindly share your thoughts. What advice do you have? It's Breast Cancer Awareness Month. What do you have to say to women out there, young girls?
Okay, so I would advise that after your menstruation, 3 to 6 days after your menstruation, make sure to do a self-breast examination. Just move to the mirror. You talked about a video that will show that, right? Move to the mirror, follow the instructions in the video, do a self-breast examination. And when you're 30 and above, start going for a breast scan. Start going for a breast scan monthly, 3 monthly, 6 monthly breast scan. For people that are 35 and above, you go for a mammography. Mammography is more specific for people above 35. So it will help to detect early, because that's the part of breast cancer that is good. You know, when it is detected early, it can be managed. So to ensure that it is detected early, try your best to do all that I have said. And then the risk factors, if you're on the big side, really there are a lot of complications of that. But in this, for the purpose of what we are talking about today, breast cancer, try to exercise. Oral contraceptive pills, avoid them or reduce them. Then diets, high-fat diets, do away with them. Oils that are not good, meaning they sleep or they congeal when it is kept for a long while. Avoid such oils. Then some women in menopause, I understand that the symptoms of menopause can be disturbing, and you tell your doctor that you want hormonal replacement therapy. That's the hormone that causes or leads to breast cancer or predisposes a woman to breast cancer. So just try to take care of it symptomatically, but don't go for hormonal replacement therapy except it is totally needed. So don't force your doctor to give you consent or to just give you hormonal replacement therapy, because it is one of the risk factors. So I think that's all I have to tell women down there on how to prevent breast cancer.
Thank you so much, Dr. Precious Zacharia, for coming today. I'm still going to drag you into the studio because you have a lot to teach us, but we really appreciate you. Thank you for stopping by.
Thank you. Thank you.
So on this note, we call it a wrap on the Good Morning Africa show right here on Housing TV Africa. Thank you so much for watching. You can watch this episode and subsequent episodes by subscribing to our YouTube channel, Housing TV Africa. You can also follow Housing TV Africa on all social media platforms. And do not forget to download the Housing TV mobile app to also watch the Good Morning Africa show and every other information you need to know about the housing sector and other sectors on Google Play Store and Apple Store. I am Mimuna Bagudo. I'll see you tomorrow. Bye-bye.